Okay, it's just after 2 o'clock. I think I'll go ahead and get started. I'll go nice and slow so people will have a chance to join before the exciting part starts. I wanted to welcome you to the webinar called Why is My Program Not Effective? How to Apply Process Evaluation in Your Research. This webinar is brought to you by the Children and Family Special Interest Group of the International Society of Behavioral Nutrition and Physical Activity, the leading global voice in behavioral nutrition and physical activity science. I am Leah Lipsky, the chair of the Children and Family SIG, and I'm here to give a very brief introduction to the webinar and some housekeeping information so that the webinar can run as efficiently as possible. First, I want to introduce our speakers, Dr. Femke van Nassau and Dr. David Just. Dr. van Nassau joins us from the VU University Medical Center in the Netherlands. She is the postdoctoral researcher with interests in the development, evaluation, and implementation of physical activity and sedentary behavior lifestyle interventions for adults and children, as well as measurement of sedentary and physical activity behavior and implementation research, including determinants, strategies, process evaluation, and measurement. She is currently the trial coordinator of the EuroFit project, a multi-center randomized control trial of a gender-sensitized program to increase physical activity and reduce sedentary activity in adult men in professional European football clubs. She also chairs the newly established Implementation, Translation, Scale-Up, and Sustainability SIG in ISBNPA. Dr. David Just is a professor of economics at Cornell University in Ithaca, New York. He currently serves as the director of graduate studies in the Charles H. Dyson School of Applied Economics and Management at Cornell, and he also serves as co-director of the Cornell Center for Behavioral Economics and Child Nutrition Program. Dr. Just's research focuses on using the tools from the fields of psychology and economics to examine ways in which implicit cognitive processes drive economic decisions. He's published over 90 peer-reviewed manuscripts and received numerous awards in recognition of his research. We're so honored to have both of you presenting your work today, and I'd like to especially thank Dr. Rebecca Stanley from the Early Start Research Institute in the School of Education at the University of Wollongong in Australia for arranging for this webinar and inviting our speakers. In the webinar, Dr. van Nassau will guide you through the key decision-making for designing, conducting, and reporting a process evaluation. Next, the speakers will present 2 case studies in which they applied implementation evaluation. Dr. van Nassau will present the design and results of the process evaluation of the Dutch Obesity Intervention in Teenagers study, a school-based obesity prevention program with a parental component. Dr. Just will present results from a recent process evaluation of the Smarter Lunchrooms program conducted in upstate New York. The Smarter Lunchroom program uses insights from behavioral economics to encourage more nutritious choices in school cafeterias. Before we begin, I want to make sure to point out that ISBNPA began supporting these webinars last year as a service to our members. The webinars are organized by the special interest groups of ISBNPA. You can see a full list of special interest groups and how to join them on the website. You will also find webinar recordings and notifications of upcoming events on the website. We are using Zoom for the webinar today. In this system, you are all muted except for the speakers and organizers. This helps to make sure everyone can hear the presentations. However, we would like to give you the ability to interact with us, ask questions, or make comments. We will aggregate the comments and at the end of the talk, ask the questions on behalf of the audience. Please feel free to ask questions along the way, but remember that we will ask them after the presentations. Also note that there is a full screen mode. If you click on this icon, you will enter that mode. From our own experience, this is the most convenient way of enjoying the webinar. Now I give the floor to Dr. Femke van Nassau and Dr. David Just.
Well, thank you, Leah. I will get my presentation on. So I hope you can all see my screen now well. Can you confirm, Leah?
Yes, we can see you
Okay,
great. Thanks.
Great, thank you. Well, thank you, Leah, for the kind introduction, and thank you all for tuning in at these different time points across the world. I would like to thank ISBNPA and also the Children and Families SIG for inviting me to this webinar. And I hope this webinar can help you to design your own process evaluation, and I hope the 2 case studies that David and I will present will help you. But I need to tell you in advance that I don't have the full solution, so I hope we can inspire you to develop your own process evaluation. And of course, feel free to contact me afterwards if you have any questions or need any assistance with your own process evaluation. As Leah already mentioned before, I'm also the chair of the just established Implementation and Scalability SIG, and we will also have a webinar next Monday, so if you're really interested in the topic, you might want to join that one as well. So I often use, now I will start, I often use an analogy for implementation, and I use a recipe book and cooking. So not everybody likes to cook. So some people do like to cook, some people really don't like it, but some just have to do it. And then the question is, if you cook, do you use a recipe book? Some always use a recipe book, but most just use it every once in a while. Then if you use a recipe book, the question is, do you stick to the recipe? So do you use all the right ingredients and do you use the right method for cooking? And then in the end, does your prepared meal or pie looks like the picture in the recipe book? Well, I do like to cook. And if I cook, I sometimes use a recipe book, but usually I don't stick to the recipe book. So when the picture in the recipe book shows this, I usually end up with preparing this because I didn't stick to the recipe book. Well, if we translate this to programs, then not everybody will be willing to implement our program. Some will be really keen to implement it, while others will think, well, do I need this? Do I want this? Then we have a manual often that guides them through the program, the recipe book. Some will use it, some will only use part of it. And then the question is, if they use the recipe book, do they stick to the recipe? So do they follow all the ingredients of your program? And in the end, will this result in the health change that we expect to have with our program? And the question, of course, remains, would they use it again afterwards? Well, to guide people through all these phases, you need an implementation plan and strategies to guide them through all steps. Well, in research, we often look at the bottom part of evaluation. So we have an intervention group who we assume get the full package, and we have a comparison group where we think they don't receive anything. But if you think about the recipe book, can we say that the intervention group received the full package? Well, that's the question, and that's where implementation science and process evaluation come in. Then we're going to look at what's happening in the full black box of implementation. So what's happening, and is the intervention group receiving the full package? So why would you do a process evaluation? Well, to unravel the black box, but I often have people who walk into my office and they say, well, I want to do a process evaluation. How do I need to do this? And then I'll ask them, so why do you want to do a process evaluation? Well, because my supervisors told me, or we promised in the grant, we need to do a process evaluation. But I think that's not the right reason to do a process evaluation. There are other reasons why you want to do a process evaluation, and then it's meaningful. The data can help you to improve your program. So you might want to test the feasibility of your program, or maybe improve your intervention for future rollout, or you want to explain the effects. So if there aren't any effects, did the intervention group receive the full package or not? Or you want to explain intervention pathways, so how does your intervention work, or contextual factors. So those are all reasons why you might want to, that you want to explore during a process evaluation. Well, you can do a process evaluation during different stages of research. One would be during feasibility and pilot testing. So that's when you're still developing your program. You might want to see if it's feasible for your population, if the implementation structure is working, and maybe if the design you want to apply in your full study is working. then you can do a process evaluation next to an effectiveness evaluation. For example, during a randomized controlled trial, you might want to look at fidelity of the implementation. So did the implementers use the program according to the recipe book, mechanisms of impact, or maybe explore context and how it influenced delivery. Another phase would be during post-evaluation. So once the effectiveness of your program has been established, you might want to look at routinization or normalization for the long-term implementation and maintenance. So during each stage of research, you can do a process evaluation. What I find a very useful practical guide is the Process Evaluation of Complex Intervention 2, developed by the UK MRC. And it's a quite practical guidance on how to develop and what decisions you need to make during your process evaluation. And I will use it during this part of the presentation. So in their guideline, they identified 3 domains. So as you can see here, there's the description of the intervention. So that's the causality you expect, how your intervention is going to work. But the blue ones are the process evaluations on how to get to the outcomes you want. So they identified context. So you might want to look at facilitators and barriers for implementation, or what context does your intervention works best. Another part would be implementation. So how is delivery achieved and what is achieved? And another part would be mechanisms of impact. So what are the responses or interactions with the participants with the program, but also maybe potential mediators. So for designing a process evaluation, there are sort of 5 steps you can follow for the design. And I will go through them one by step. So first you have to design what theory, or you have to think what theory or framework will I use. Well, in the implementation and process evaluation field, there are many frameworks. So here are some numbers. So there are 61 dissemination and implementation frameworks, and this is from a review from 2012, so there are probably much more right now. There are 73 implementation strategies defined. So those are strategies that can help to change the behavior of your implementer. It's quite similar as what we do with effectiveness of interventions. So we have strategies to change the behavior of your target group, and these are strategies to change the behavior of your implementation in order to promote implementation as intended. There are also 420 implementation measures identified and 601 practice determinants. So there's quite a lot to choose from. And a few often used frameworks are, for example, RE-AIM for process evaluations, the model of Steckler and Linen, or maybe Durlac and Dupre. And they all have quite a lot of overlap in between the frameworks, and some are maybe developed for a different target group or a different setting than where you will conduct your research, but it's often possible to translate it to your own setting. And I think it's important, if you choose a framework or a combination of frameworks, then stick to it. So make sure through your whole process evaluation, you stick to the same framework. Well, next once you've decided what framework you will use, you need to think about, how am I going to organize my process evaluation? So for example, what staff do I need? Are you planning to do some quantitative or qualitative work? So if there's also qualitative work involved, you might need to think about an expert in your group or someone that can help you. So you do really good research, so it will have valuable meaning, the results you get. But also have a good relationship with stakeholders. For example, if you want your implementers to join interviews, report questionnaires, and do all the work, then you need to have a good relationship, so they are willing to help you to provide the data. But also make sure you have some time and budget available. Often we think about the whole effectiveness evaluation and we allocate the time and budget, but for process evaluation, you need to take that into account as well. And also for analyzing the data, because we often collect a lot of process data, and then in the end we have a bunch of data, and then we need to think about, okay, how we're going to analyze it. So you need to take account time for that. Then you need to think about, what role do I want to play? Do I want to have an active or passive role? For example, if you see that implementation is not going well or not as intended, do you intervene or not? So do you leave it just the way it goes, or do you intervene and then change implementation? That's something you need to decide on forehand. So what role do you want to have? But also reserve some capacity for unforeseen issues and think about what is your intervention. So what am I actually evaluating? What is the causal pathway? How is it supposed to work? And if there's no description of the causal pathway available yet, you might want to sit with the developers or the implementers to see, okay, what is it we are going to evaluate right here? So once you've figured out some of those things, you want to think about, so what's my research question? I already addressed it a little bit in the beginning. So why do you want to do a process evaluation? Because if you just start collecting data, then you'll have so much unstructured data and it will be really difficult to analyze. So you might want to think about implementation. You might want to measure reach and recruitment of your population, or you might want to look at how much is delivered, or was it delivered with fidelity? Did my implementer stick to the recipe book? Mechanisms of impact. You might want to think about views and experience of participants and implementers that might have impact on your outcomes. Or maybe at some mediation and moderation analysis. So you want to think about variables you want to include in your questionnaires to allow those analysis. Understanding contextual factors. So maybe you want to look at what factors either facilitate or barrier implementation. Because if there are a lot of barriers, you might not get the implementation result as expected. But if you look at facilitators and barriers, you might find some reasons why it didn't work as intended. Or maybe you want to look at needs for post-evaluation scale-up. So you want to look at program improvement. So after your evaluation, you want to make some adjustments to the program to make sure it's better suited to the implementers. Or you might want to look at the active ingredients. So what's making the intervention? And you might want to measure that. So you can choose what you want, but I think you should really clearly focus what are your research questions. And I think also look what is interesting from a scientific perspective, but also what's interesting from a policy perspective. Because if you collect those data and analyze the data, you can make sure your data is meaningful, so it will help future implementation. So once you figure those things out, you can think about, so who am I going to ask questions to? So will I just randomly ask people, or maybe I want to purposefully ask a group who did really well on the intervention, or maybe those who did not do really well on the intervention. Maybe you also want to ask some key process variables to a really large group, and then maybe go some more in-depth with smaller specific groups. Think about when are you going to measure. Maybe you want to measure before, midway, or after. They all have some advantages and disadvantages. So for example, if you use questions after implementation, that often happens a lot, you have to take into account that there might be some recall bias, so people might not remember everything as well. Then you can see what methods will you use. Do you use quantitative methods, qualitative methods, or maybe you go for a mixed method, so you first look at some quantitative data, and then based on the results, you might want to look into the qualitative explanations of those results. And they all have some advantages and disadvantages. And I think it's up to you to decide what you want, and also what's feasible for your population. So what's reasonable to ask and what not. And I think it's really good, if I see process evaluation, a lot of the time people just design their own questionnaires and think, well, we're going to measure this, and this is suitable for our population. But I think there's quite a lot of measurement instruments out there, or have been used by others. So I would recommend to see what others did and try if you can translate it, or if it's suitable for your study, because that will allow us to make some comparison between studies instead of having all these different methods for measuring. I do want to point you to this website. It's disseminationimplementation.org. I think it could be a very useful website when you're in the development phase of your process evaluation, because it provides an overview of all models that have been used and how they, what they consist of. And also, there's a possibility, as you can see here, for they have a description of all measurement constructs. So for example, here you can see acceptability and feasibility. There's a full description of what how they define it here. And there's also the number of models that have included this specific construct in their model. And also you can find some examples of studies and how they measured it. So I think this will be very useful when you're designing your process evaluation. What I also found, what I also find really useful to do is to make a data matrix. I think for effectiveness studies, we're quite used to do this. So we really structure, what are we going to study? How do we measure it? What are the research options? And how do we analyze this? And I think for a process evaluation, it's really worth to do a similar thing. So once you've identified your framework, method, and timing, I think you can frame in a matrix. You can place your process indicator, then say how you operationalized it. So for example, in the Do It study, we used dosage as an indicator. We said, well, for dosage, we say that's the amount of Do It lessons that are delivered or taught by teachers. We measured it on 2 levels, so student and teacher level. Both the students, we asked them to complete a program at the end and report it back. So we asked them to tick which of the following lessons they received, and then yes, no. And for teachers, we had an ongoing logbook, and we also asked them, did you deliver this lesson? And for analysis, we said, well, there are 16 lessons, so we can count them up to get to a number. And I think what's really the benefit of doing this, because it's quite some time to put everything in the matrix, but it will make sure that every question you ask is linked to a process indicator. So it's valuable information, and it will prevent you from asking a lot of questions that in the end up losing somewhere in a database without being used. And I think you can also do this for your qualitative work. So if you do an interview or a focus group, make sure there's a real focus. What do you want to learn from that interview or focus group? So it contributes to your process indicators. Well, once you've collected all the data, I think it's important to make an analysis plan. So how are you going to analyze the data? What are your tables you want to complete? What is the information you want out of it? And I think the matrix can really help you to inform your analysis plan. Think about when are you reporting. So if you're doing, for example, a process evaluation next to an effectiveness evaluation, do you maybe want to look at process information first before you do your effectiveness analysis, so you're unbiased? Or maybe you want to do it simultaneously, but that's something you need to think about on forehand. And think about what else do you want to do with the data? What questions do you want to answer? For example, do you want to look at a relation between process outcomes and maybe other outcomes? So as implementation variability and effectiveness or cost effectiveness. And also maybe you want to do some mediation analysis, for example, to see if the logic model, so the way your intervention works, is really working or supported by the data. And I think once you've did the analysis and got your findings, it's important not only to publish papers, but also to disseminate your findings to policy and stakeholders, because they are the implementers. They are the ones that will do future implementation. So it's important to feed back to them so they can also learn from it. I think it's important not to measure everything. And that's hopefully something you remember from this part, because it will be a big burden for your target population, but also for your implementers who you're asked to complete questionnaires or maybe join interviews. But it will also be a big burden for yourself, because you will have so much data and then you don't know where to start or where to end. So I think I would recommend you to choose the most relevant data for your study to answer your own research questions. Well, this brings me to the first, the ending of the first part of this webinar, where we just wanted to give you some practical guidelines on how to conduct a process evaluation. As I mentioned before, it's not that clear yet, but at least I think I hope I have given you some food for thought on what to think about and how can you design your process evaluation. Well, next I will start with an example, a case study of the Dutch obesity intervention study, and next David will present another case study. So hopefully those two studies can help you to learn a little bit more how we apply this in practice. So the first study is the Dutch obesity intervention in teenagers. It's a school-based obesity prevention program, and it's targeting pre-vocational students. So they're the first 2 years of pre-vocational education. So those are the more lower educational levels in the Netherlands. The program is targeting both the dietary and physical activity behaviors, and it's building on the self-regulation theory of Zimmerman. The program consists of 16 lessons, both biology and physical education lessons, and they're divided over 2 school years. So in each year you have 6 biology lessons and 2 physical education lessons. The program also consists of a parental and environmental component, and it's delivered by teachers. And it's developed in a way that teachers can replace their regular physical activity or dietary lessons by the do-it lessons, so they don't need extra time. And schools could buy the program for €7 per student. And I did my PhD on the evaluation of this part, so if you want to learn more about it, I'm happy to share my thesis. Do-it was developed through the intervention mapping protocol, and my colleague Amika Singh, she did a randomized controlled trial a few years ago to see to test the effectiveness of the program, and the results were quite promising. So we found weight loss in children, so skin folds went down, waist circumference in boys, and also reduction in sugar-containing beverage consumption and screen time in boys. So for a school-based prevention program, I think those results were quite promising. So that's why we decided to adjust the program based on recent new literature and some interviews we did with students, parents, and teachers to make it even more feasible for them. And also we developed an implementation plan for scaling up, so to support the teachers through all the processes of implementation. So what materials does the Do-It program consist of? Well, it's materials for both students, teachers, but also for parents. So students have a workbook, and it's based on 2 versions, one for the more lower levels and one for the higher levels of pre-vocational education. Then the students had also a worksheet and a toolkit, for example, consisting of a pedometer to measure steps. And they also had a computer-tailored advice consisting of a website where they could go to and get some personal advice for behavioral change. For teachers, we developed a 7-step implementation plan and also a manual, so the Do-It recipe book. And they got a login for the website where they could find additional materials, because based on the interviews, the teacher said, well, I do like the program, but I do want some flexibility to adjust it to my facilities and my students. We also made an instruction video for teachers. And now you may be thinking, so why wasn't there a teacher training? Well, during the interviews, it became really clear that teachers didn't want a full day training, for example. They said, well, we can replace our regular lessons by the Do-It program. So we know what to do. Just tell us in a short video or instruction what the program is about, how we need to apply it, so how does it work. So that's why we decided to only have an instruction video. And for parents, we had a few parts, but for materials, we had a parental booklet and also some homework assignments that students could do together with their parents. Because during the interviews, it was they told us that, well, if you want to involve parents, you need to do that through the students, so they involve their own parents. And in that way, we also had a parental nights where students could present what they learned from Do It, and then they would invite their parents to come. Well, to evaluate the real-life implementation, we conducted a cluster-controlled real-life study. So the first 20 schools who bought the program from the Do It office that was situated at our university were invited to also join the evaluation study, and we found 9 matching control studies. And we measured them before implementation and after the 2-year implementation. And alongside this study, we conducted a process evaluation, and that was the core of our study, to see what's happening within the schools, what's the black box with the implementation of Do It. So we wanted to look at facilitators' barriers, but also to measure what happened in practice, and if we could relate that to health outcomes. So how did we design our process evaluation? Well, we defined 8 process indicators based on several models you can see on the bottom of this slide. So we made a combination of Fleuren, the model of Steckler and Linnen, the Re-Aim model of Glasgow, the Wojcicki, that's difficult to pronounce, the Mitrovic and Sanders. So these are the items we selected. So we looked at recruitment, reach, context, those delivered, fidelity, satisfaction, effectiveness, and continuation. And we decided to have a passive role. So we wanted to have a real life evaluation. So whatever happened in the schools, we didn't intervene. We just wanted to see what happened in practice. Well, for methods, we selected several instruments. So we asked teachers to complete 3 times the questionnaire, before, after 1 year, and after 2 years. And after the 1st and 2nd year of implementation, we conducted an interview with teachers. We also asked them to complete logbooks from each lesson they delivered and observations. And we asked students to complete, after the 2-year questionnaire, with some questions about the program. We had a parent questionnaire and a school audit. Well, that looks like a lot of instruments, and I think that already brings me to the first thing we learned during this process evaluation. It was too much. So, for example, we didn't do any observations in the end, because we thought, well, we could do some observation, but what is the aim of the observation? We had it in mind to do it for fidelity reasons, to see if they would stick to the Do It recipe book, the manual. But in practice, it was not feasible for us to visit schools because teachers couldn't tell us when the lessons were. And on the other hand, we didn't have a real structured way to observe lessons. So if you have one lesson and then see if it's done with fidelity or not, what does this tell for the whole implementation? 20 schools, more than 100 teachers, so we decided not to do observations. We had a really good hope that logbooks would work, but in the end, we only got 10% of the logbooks returned, and we distributed them via an online system, so we could even track and remind the teachers, but it was really difficult to get logbooks back. We used questionnaire data, but the parent and audit data was also too much. In the end, we didn't analyze it properly to answer our research question. We did collect the data, but still we collected too much data to analyze. So what happened in practice? So how did implementation go? So we measured a lot on different process indicators. So this is for the implementation part. So we had a teacher with completing 3 questionnaires and 2 years of implementation. Well, the good thing is that the recruitment went well, so it was easy to recruit the schools. Those who signed up were quite easy to join the research as well. And teachers regarded the program, they liked the materials and said it was really suitable for their children. From the first year, 6 lessons, they implemented on average 3.5 of the lessons. And from the 6 lessons of the 2nd year, 2.2 were implemented. And of those implemented, half of it were implemented according to the teacher manual. So this is all self-report of teachers. So teachers reported that they did some implementation and it decreased over time. But I think, this is what it is. So teachers were satisfied, but children were also satisfied themselves. So they said they liked the materials. It had a lot of pictures, although they sometimes said it had a little bit too much text. If we look at parental involvement, the teachers, 1/3 of the teachers distributed the parental booklet, and 84% had given homework assignments. Also, 1/3 had given information about Do It in the parental newsletter, and 9% organized a closure meeting. so that it's not too much. And 1 in 3 teachers reported that they embedded the program in their school curriculum. So I think overall, this is what happens in real life. So you think they will follow your recipe book as it was developed together with teachers. And in the end, well, there were some reasons why they didn't do that. So that's why we looked at facilitators and barriers. What teachers reported that facilitated implementation was the involvement of a do-it coordinator that was appointed in each school to coordinate between physical education and biology teachers. And they also liked the support of the do-it office that was installed in our university for questions. If there was sufficient communication and collaboration between teachers, that really facilitated implementation, as well as a strong motivation of teachers, and they liked the flexibility of the program. But they also mentioned some barriers. So for example, if teachers had a lack of planning, especially for a 2-year delivery, that was really a barrier for implementation. Schools reported a lot of unforeseen other priorities, so they had to reschedule lessons or could not deliver lessons because there was other stuff they had to do. A lot of schools faced with teacher turnover and they did not have a plan to cope with this. And almost all teachers reported to have a really high workload. So the question is, did this all result in any health outcomes within the children? Well, overall, we didn't find any results. Not on any of the measured energy balance related behaviors or on measures of overweight. But then we also looked at some moderation and mediation. So gender moderated the effects. So what we saw is that in girls, we were able, after 2 years, to see that they decreased their sugar-containing beverage intake. And in boys, there was an increase in breakfast consumption. We also tested the mediation effect of behaviors on overweight, but we didn't find any significant outcomes. So our first randomized control trial, we found really promising results. And during this real life evaluation, we didn't have those great results anymore. So what could be the reason? It might be that we made changes to the program that were too large, so the effectiveness was diminished by that. Or maybe there were some methodological issues, so we measured before and after 2 years, so there might have been a small change in behavior, but it was decreased by the time we measured them again. But it could also be that the real life evaluation made implementation not controlled. So maybe teachers just didn't stick to the recipe as much in order to receive health outcomes. So that made us think, well, we need to maybe look a little bit more into implementation, see if we can define low and high implementers. And that's why we decided to develop an implementation index score. So building on the model of Domitrovic, we measured fidelity, dosage, and quality of delivery on the intervention as well as the support level. And we combined that into an implementation score. And why did we do all this effort instead of just adding up amount of lessons that children received? Well, we think that only adding up the amount of lessons, so the dosage children receive, doesn't reflect full implementation processes. I think fidelity and also quality of delivery also play a role. So that's why we try to make a combined score. So we selected items of the teacher questionnaire and we used confirmatory factor analysis to have an individual loading of each item, and then we used a weighted score to get to one implementation index score for each school. And then we looked at the difference between low and high implementer, and we found some indication that higher implementation tended to lead to better health outcomes. So that would say that implementation does matter. Well, the implementation index score was really an explorative, innovative way of looking at implementation. So I think that needs a little bit more work, but I think there's something in it. And it also is in line with literature that often showed that higher implementation leads to better health outcomes. Well, to wrap up this part of my presentation, I think for the Do It program, although we used a really structured approach, we still collected too much data. So we were, so I think that's kind of still a waste of research resources and capacity, and also what we asked from our implementers. We were able to distinguish between low and high implementers, and I think that's really valuable information, because if we only would have looked at effectiveness of intervention versus comparison group, we didn't find any results. So I think it's interesting to take into account what's happening in practice. And I think that if you really select your process evaluation well, and I hope that the information I gave and the example of Do It can help you to design your own process evaluation. And I hope you will take that into account and make sure your process evaluation is meaningful. Well, thank you. And I think now David will continue with the second part. So he has also a case study from a different program that he will share with us. And hopefully you can build on both studies to design your own process evaluation. So David, are you there?
I am here.
Great.
Hopefully my presentation is up and working now.
It is.
It looks great.
Great. So thank you, Femke, and it was a wonderful summary and illustration of the power of these process evaluations. I'm going to shift gears a little bit. This is couched as somewhat of a case study, but I have to, from the outset, say, I'm not an expert in process evaluation, so I think actually I might frame this more as a testimonial of somebody who's not involved generally in process evaluations, of what sorts of things can be done. And to begin with, I want to just introduce the program that I'm involved with, that we used for this program evaluation, or process evaluation. Let me see if I can make sure my slides advance. There we go. So this is the Smarter Lunchrooms movement. This is some work that I founded with a colleague several years ago, based on the idea of using the tools of economics, marketing, and psychology, in a school lunchroom to try and encourage children to consume better foods, to take more of the fruits and vegetables, to take more white milk rather than chocolate milk, to reduce food waste, and also trying to increase participation in the National School Lunch Program in the U.S., which has, as of now, some very good and relatively strict standards in terms of nutrition. But these guidelines have actually been somewhat of a challenge for a lot of school districts in just encouraging kids to eat the food itself. This is one of the things that has been raised over and over again. And so really one of the things this program has been is something of a complement to these new guidelines that made sure the food being offered to children were high quality, foods that had the nutrition they needed. And complement that with trying to motivate kids to eat the food and to take the food. And basically we try and do this using the school lunch environment itself, setting it up in a way that leads kids naturally to take healthier foods. And while we base the program off of sort of 6 key behavioral principles, there are 3 that really do most of the work. And I want to talk just briefly about those so you have an understanding of what this program is. And really, if you put yourself in the position of being a student, walking into a school lunchroom and getting ready to order lunch, on average, you come in and you really don't have strongly in your mind exactly what it is you want to take. A lot of what you decide you're going to eat and what you think even is available is going to be determined by what you see and by what's easy to grab. And so convenience, visibility, and what we call here enhancing taste expectations are what really drive a lot of the behavior that we see. And this program was built on a lot of research studies, randomized experiments in dozens of schools and actually hundreds of schools, I guess I should say. And we've done these things over and over and over again. We've had other research groups replicate a lot of the results. But there's that evaluation of the effectiveness of the program as we roll it out in a controlled setting versus what happens in the real world. But let me first talk about how this worked in the controlled setting. Let's see, the computer keeps trying to slow me down. So talking about convenience, just give you an example of this, and there are several others. If you think about kids and fruit in particular, if you're in elementary school, mostly often you're going to be missing a tooth or two, and it's going to be hard for you to bite into an apple. Later on, you'll have braces, and you'll have the same problem for very different reasons. Or if we're talking about an orange, it is always going to be messy and sort of difficult to peel that orange. And having that slight bit of inconvenience actually plays a role in what the kid will decide to eat in the end. And to sort of test this, we ran some experiments. These are from our original set of pilot experiments in a set of schools in upstate New York, where we introduced a fruit slicer. And after introducing a fruit slicer and presenting only sliced fruit, you would see in each of these schools we went to, in some cases, a really, really substantial and large increase in consumption of fruit, where in others it's a little bit more modest, but in each case it was something that was positive and overall significant. Not only that, it drove down waste by about 30%. And so it shows quite a bit of promise that introducing this sort of convenience is going to be helpful in getting kids to go ahead and eat the fruit that's being served rather than getting it thrown into the garbage where it just creates expense without really the benefit, right? Another example of this sort of convenience and how you can use it to encourage kids to eat a little bit healthier. A lot of schools in the U.S., we have, there's a national school lunch program that meets the school lunch guidelines and has these sort of high standards for a full meal, but they also sell a la carte items. And while now those a la carte items need to meet some high nutrition standards, typically you don't have as much control over how much kids are eating, and oftentimes these are less healthy items overall, although like I said, the new program makes it so it's not quite as big of an issue. So we went to a set of schools in the southern tier of New York, where they had a couple of different lunch lines in each school, the same cafeteria, and in both cases, these lunch lines were offering identical things: the National School Lunch Program qualified lunch, and then a whole bunch of snack items. And this was before the snack items were covered under the new guidelines. So these were like real snack items, like potato chips and brownies and cookies and things like that. And what we noticed when we were there is it takes a long time to get through those lines generally. And so we thought we might be able to use that time pressure to create this sort of convenience incentive. And so we took a set of control schools, a set of treatment schools. We would modify the lines so that one line still offered everything, and another line offered only grab-and-go sandwiches, salads, and chocolate milk. And they were combined in a way so that they created a qualified lunch for the National School Lunch Program, but none of the snack items were available in this line. And what that meant is you had a grab-and-go line that was very fast to get through, where you could get the whole lunch, or a slow line where you could wait and get the other items if you wanted it. And what we saw over a period of a semester, sales of the healthier foods increased by about 18%, and we got a decrease in the sale of the less healthy foods that we were trying to discourage by about 28%. While overall, you saw a significant increase in participation. Why? Because it took less time to get a lunch, and so they were more willing to participate. Another key is visibility. Like I said, usually you walk into the lunch line and you're not thinking specifically about what you want to buy, and you aren't aware of the full menu. So what you see is basically the menu. It's what you think are the choices there. And unfortunately, a lot of schools will present fruit in a way that looks something like this, where it's not terribly visible. It's sort of below eye level. And because in this particular case, it's between shelves, it's actually sort of hard to reach. You have to sort of contort your hand to get it, which makes it less likely that kids are going to take it. And so one intervention we used in one set of experiments was simply taking the fruit, putting it in an attractive fruit basket, like the one pictured here, and putting it somewhere where it's very visible, right by the cash register. And here you can see from these pilot experiments, again, run in upstate New York, again, things that we've replicated elsewhere since then. You get a very substantial increase in the selection of fruit. Most of the studies we've done along these lines, that increase in visibility basically doubles selection of fruit. Pretty robust result generally. The last one I wanted to mention is enhancing taste expectations. This is one that's a little bit less intuitive. Basically, this is based on the premise that really what we taste has a lot to do with what we think we're going to taste, right? If we seed an individual with an idea that something tastes really great or that it has some specific sort of hedonic qualities, they look for that as they taste it, and they rate it better, and they consider it to be better quality. This is a word cloud created just from copying and pasting a menu from a chain restaurant in the US. If you look, there are a whole bunch of words in here like fresh and house-made and served spicy, right? All of these things give you descriptions of the sensory experience you're about to get. They would never serve something like meatloaf. They would serve mom's homemade meatloaf, something that sounds a little bit, you know, it gives you some sort of emotional attachment to whatever it is. And by doing that, they enhance your expectation of this taste. And it's not just the descriptions, but also how things are presented can sort of enhance the way they taste. These pictures, of course, come from the internet. These are basically food porn. And if you didn't know, when they create these sorts of pictures, artistic pictures of food, they usually are using chemicals to make them look this beautiful. And you'd never want to really eat them, but they look great. And if you have something served to you on a beautiful dish and it looks nice, you start to think it's going to taste nice because somebody took a lot of care in preparing it. And we have several studies showing things along these lines as well, which I'll spare you. Overall, this Smarter Lunchrooms program, I guess my piece of it is really, I do a bunch of research in schools to see how we can nudge kids without sort of changing the menu and without costing a lot of money, how we can get kids to eat a little bit healthier by changing things in the environment. And then I work with my outreach team to disseminate this throughout the country and also to a few other countries as well, but primarily in the US. And we do that in a bunch of different ways, but primarily we offer training, and we offer this Smarter Lunchroom Scorecard. Essentially 60 different points on this scorecard, things that are very easy to figure out, am I doing this or am I not doing this? And you count up your score, figure out where you fall. And this represents 60 different little behavioral interventions, things that shouldn't take more than a couple minutes to implement and shouldn't take much money to implement. And how we get those implemented, we travel around the country and we offer trainings. Most recently in Minnesota, or I shouldn't say most recently, but one of the most recent big efforts we had was in Minnesota, where we trained 130 people, and it reached 74 different schools that began to implement. They're trained on how to use this scorecard and how to actually implement in the field these different principles, with the goal of getting them to just do a few things on the margin, 3 or 4 more, check marks on that scorecard to try and encourage a little bit more work on getting kids excited about eating fruits and vegetables or lower calorie drink options. This is right now we're in about 30% of schools in the U.S. It's a pretty wide distribution. You look. This is not adoption. This is awareness. This is from 2015. Awareness is just about double adoption. So about half of those who are aware are actually adopting, which is a great thing. But adoption doesn't mean effectiveness, right? And that's sort of where this came in, because in running our experiments, we had noticed a few things that sort of caused us to wonder exactly how does this work in the field when it's hands off, when we're not the ones controlling everything. A couple of stories just to sort of motivate this. We had this one school that we went to, and they had this inflatable cow that said milk on it, hanging from the ceiling. Nothing particularly special to us, and it was sort of in the way of the intervention we wanted to put in place. So we asked the school lunch manager, the food service manager, if we could move it for the duration of our experiment, and she said, sure, go ahead. So we took the cow and we put it in a closet, and we started our study. The school lunch staff was absolutely incensed, and they were so angry about this that literally all of her regular school lunch staff took sick leave the entire time that we were running this experiment, which of course then makes it hard to argue that everything we were seeing that changed was due to our experiment rather than the whole staff turning over while we were running this. And so we refer to this as the sacred cow experience, and we try to be aware of the staff's view of the lunchroom and ownership of that lunchroom. But it again made us question exactly how this goes over where we're not involved. The other quick sort of experience I'll share with you comes from another school where we were running experiments, where one of the school lunch staff just bought on hook, line, and sinker to what we were selling. She absolutely loved the program. She totally believed in it, so much so that as we were beginning to implement, she went home, searched the web, found 30 other things she wanted to implement in the school lunchroom, and went to town. And of course, our intervention was super successful in her school, but it had very little to do with what we were intervening with. It had a lot to do with her doing a whole lot of other things at the same time. And again, that causes problems for us figuring out exactly what we were supposed to get out of that experiment. Both of these sort of gave us the idea we really needed something of a process evaluation, and without much experience on our own of how to conduct such a thing, we engaged the help of Jamie Dollahite here at Cornell and her research team, and teamed up together on an AFRI grant, USDA sponsored, that allowed us to do just that. It paired our research in the field with their process evaluation in a way that I think is extremely powerful, right? And there's a bunch of pieces to this research, and I'm just going to present one and really present it from my point of view as to how this benefited me as somebody who created a program that is trying to figure out how to implement it effectively, right? Here we had a protocol where schools had a few different things they had to meet in our treatment group. The control group was supposed to not be changing anything, of course. There were a whole bunch of different schools involved, and they could implement several different changes with respect to encouraging fruit. There was another group that was implementing changes trying to encourage vegetable consumption, and another group trying to encourage milk, white milk consumption, I should say. And you have the numbers here. Here you can also find on this slide listed some of the specific things that we encourage, like laminated signs, advertising the fruit, giving them attractive names or names that are sort of funny. We in fact had school students come up with those names, which led to an interesting exercise on Urban Dictionary right after to make sure they were okay. Not all were. And you can go through the rest of these and see exactly what sorts of things I was looking at with respect to fruit, veggies, and milk. The process evaluation itself. So it covered really all three parts, where we had cooperative extension here, or people who were associated with the university and outreach efforts, training people in the schools on how to implement this and helping them in implementing it. They were also collecting the data throughout the intervention. And then we had people from the research team visiting the sites to go through and check, are they really doing what they say they're doing, right? Are they really implementing everything the way they say they are? And also to talk both before and afterwards about their perceptions of this program, its effectiveness, and whether they think they were doing what they were supposed to be doing all the way along. If you were paying attention earlier, they were using the re-aim framework to put this all together. And so there are a lot of other measures besides the one that I'm going to talk about, but ones I'm going to talk about are the ones that I think were most important from my perspective. So what did we find? Well, compliance with the fruit interventions was extremely high. It was about 70%, and you might say extremely high. That doesn't sound extremely high, but actually it's better than what I thought it would be. 70% is pretty reasonable. Vegetable was about 50%. And of course, these varied depending a little bit on what the actual specific intervention they wanted to implement was, as well as milk was about 45%. So if you're looking just purely at fidelity pre, during, post, right? What you find is they were actually doing some of these things beforehand, and it made it so it was difficult to implement much more after things started. But fruit, we get this really good slope on that line, if you will, that shows there really was some difference between how things were being implemented before and after the program. Though very few things stuck around after we left. And we've done a little bit of thinking on that afterwards. Thinking about the sort of facilitators and barriers. Well, I would break these out into two different sort of categories. There are the things we can address and the things we can't, right? So part of the problem that we ran into where they couldn't do this was just changes in the school lunch program itself that were going on. It made it impossible for us to do some of the interventions we wanted or measure some of the changes we wanted, I guess. There were some health department regulations, so putting fruit in a basket is a wonderful thing, but you've also got to make sure that it's sanitary, and that usually means wrapping fruit. It can cause a little bit of inconvenience on the part of school lunch staff. The structure itself, the time constraints, these are all things that we really can't do too much about directly. What we can do something about is address this whether the providers really perceive this to be effective or not, and the amount of buy-in they have, and the types of presentations we make to them and the amount of engagement we have with them could actually be something we could address or use to address this sort of problem, and it seems to have been successful in some instances. So there's a barrier that we've identified that really could make a big difference for us. In terms of facilitators, things that really help, the national recognition of the Smarter Lunchroom name was something useful. If they had already heard of us before we got there, that was something beneficial to us. There were also a lot of benefits to them understanding how this affects their cost structure and the participation rates, things that could actually help them budget-wise, as well as support from those who were sort of overseeing the interventions. I guess sort of thinking about why this is so important from my point of view, it really gives us a point of focus for how we can change the program going forward to to try and make sure that we address the things where we are really failing. There's another sort of piece of this process evaluation that is not quite completed. I will say we saw a much bigger effect for fruit than we saw for vegetables, and there's a lot of suggestive evidence already that fidelity had a lot to do with effectiveness, but we're not completely done with that analysis yet, so I won't quite claim it. But wait for it, I will eventually, I think. But here we're offered an opportunity to really see how we can improve this program that's already, you know, nationwide, and make it so it's something that will really have an impact on the children in the end, and what sorts of things get in the way of that we can overcome. You know, it identifies some of the weaknesses we can't overcome, but it also identifies those that we can, and makes for, you know, a really effective way to design strategy moving forward. And the last thing I will just mention is just yesterday we relaunched the Smarter Lunchroom website, and so if you're interested in the program, I would point you to that website. It's great information. And at that point, I will quit.
All right, thank you so much. Femke, would you like to address some of the questions that we've received?
Yep, sure. Maybe I'll start on the top. It's from Soren Smedegaard. He says, I said stick to the chosen framework, but often it's not possible to have measures on all elements of the given framework. And I think that's also linked to the second one, that I used several frameworks in my process evaluations. And the question is, couldn't you find one framework that was covering everything? And I think that's the fact. So we're looking into frameworks and see how we wanted to develop our process evaluation. And well, there wasn't one framework that fully suited the questions we wanted to answer. So that's why we made a combination of different frameworks to cover all topics we had. And I think an often used one, and David also referred to it, is the RE-AIM framework that covers a lot, but there's also the limitation that it's not really clear, pointed out what implementation, for example, is. So I think you can look to other studies, what they did and how they selected their framework. And if there was one framework that worked for them, it might be useful for your study as well, and can help you to design your process evaluation. I hope that's answering your question. Otherwise, just put in another Q&A. And I think there's one for David next.
Sure, and this is also from Søren Smedgaard. So asking about index score, if we've done something along those lines. I should mention first, I forgot to, the process evaluation has actually been published. I'm not a co-author on that publication. It's Laura Thomas, Tisa Hill, Alicia Gaines, and Jamie Dollahite in the Archives of Public Health if you are interested. But in any case, we haven't, I mean, we do have an index like that, and we're sort of working on trying to create an index that will allow us to sort of measure against effectiveness. I mean, this is sort of the plan, and you know, is something along those lines, but maybe not exactly what Femke had done. But we're sort of mid in that process right now. So hopefully we'll have something for you soon.
Exciting.
I have a quick question for both of you. I'm wondering what your thoughts are as far as whether there's a difference in the importance of process evaluation when you have the intervention effect on the particular behavioral or health outcome versus no effect. I can see how the process evaluation would be valuable in different ways, but I'm wondering if one of the other main outcomes would lead to maybe the process evaluation being either more or less important.
Well, maybe I can start off. I think it doesn't, well, if you don't find any effects, you want to know why didn't my intervention work? Because you designed it in a way based on probably theories that you expect it to be effective. So if you don't find any effects, you might want to look into that. But on the other hand, if you do find effects, you might want to look at, so what happened? So what are the key ingredients and why was it successful? And is it supporting the causal pathway of your intervention? So you might want to look into that, or maybe look at the specific context influences, and if you would like to translate it to a different non-research setting, if that would still be effective in that way.
What do you think about, because the scenario that's coming up in my head is a significant effect on the health or behavior, but no effect on, no findings that you were hoping to find in the process, which would mean that you had the intervention worked, but you have no idea how, and so where do you go from there?
Yeah. Is it from your personal experience?
No, but I'm just I'm a researcher, so you're always thinking of what will not work.
Yeah. Well, I think that's why it's important to really clearly define your process evaluation. So at least what you measure, you can see if it's working. So if I understand right, so there are some effects, but your process evaluation doesn't show that it was implemented properly. Is that what you mean?
Or maybe just not, maybe the process by which the intervention worked was just not how you theorized or how you hypothesized. And so if you are doing a process evaluation based on your expectations and then it doesn't work out that way, that would be a frustrating situation to be in, I feel like.
Well, I think that's why it's valuable to do mixed methods. So you have your quantified, quantitative data, which is based on the expected pathway you would expect. So that's why what you question. But then if you go into interviews and maybe focus group or observations, you might see what's happening there, and you might see some or hear some things that you didn't thought of before that could influence implementation. For example, the example that David gave with all people resigned from their duty. I'm not sure if you want to continue, David.
Yeah, that's how you find out about the sacred cow. You've got to talk to people, and I think that's actually a good way to think about it. Is if your process measures aren't working out, then you've got something more to learn, and it's going to be a lot more of a an exploratory exercise, and you're going to need a lot more sort of open-ended type of questions that you're going to ask, right?
Well, does anybody else, any of the other participants listening, have any questions? There's a Q&A icon at the bottom of the screen where you can submit your questions so we can see them. We are beyond the time, so I don't want to keep anyone too late, particularly further east of us. I'm not seeing any, so I think thank you again to Femke and David. Those were wonderful presentations and just very informative. It was an honor listening to you, and thank you everyone for participating, and hopefully we'll see a good number of you and hear more about it at the conference in Victoria later this year. So if our speakers have anything else to say?
Thank you. Enjoyed
okay.
It.
Yeah, thanks as well. It was great.
Thank you, awesome.
Bye. Thanks, everyone. Have a wonderful evening.